Welcome. My name is Jen Johnson, and I am a senior advocate with the ARC Greater Twin Cities. Thank you for joining us for our caregiver support webinar. Before we begin, I wanted to let you know that your lines are muted. If you have questions or comments as we move through the presentation, you can submit them by typing them into the question box in the toolbar on the right-hand side of your screen. I'll be collecting them and answering them verbally at the end of the presentation so everyone can hear the responses. Today's presentation is also being recorded and will be available on our website in the coming weeks. Before we dive into today's topic, I want to tell you more about the ARC. The ARC Greater Twin Cities is a nonprofit organization that was started in 1946 by a group of families who had children with disabilities and wanted a better life and more opportunities for them during a time when the options were to either institutionalize them or keep them at home, hidden away from the community. Over the past 70 years, the ARC has grown to over 700 chapters across the country, with a national chapter based in Washington, D.C. The ARC Greater Twin Cities mission is to promote and protect the human rights of people with intellectual and developmental disabilities, actively supporting them and their families in a lifetime of full inclusion and participation in their communities. Our chapter serves people with intellectual and developmental disabilities, or IDD, and their families in the 7-county metro area. We offer a wide range of programs and services with an overall focus on providing information, assistance, and advocacy support to help people with disabilities and their families navigate different disability service systems. Those include education, healthcare, employment, housing, government benefits, and county services, to name a few. We also offer a variety of planning services, including person-centered planning and long-term legal and financial planning. You can learn more about us by visiting our website, arcgreatertwincities.org, or giving us a call. We also have 5 Arts Value Village thrift stores throughout the metro area, which are located in Richfield, Brooklyn Center, New Hope, St. Paul, and Bloomington, that directly support the work we do with people with disabilities and their families. By shopping, donating, and volunteering at one of our stores, you are supporting our mission. So our objectives for the presentation are listed here. We'll look at data, trends, and issues about caregivers in the United States from a few studies to better understand who is caregiving and what are the concerns and challenges they're experiencing. We will also look at specific groups of caregivers who have unique needs and circumstances. Throughout the presentation, you'll notice caregivers' comments and insights are woven into the different topic areas we'll be discussing. We'll talk about self-care, an incredibly important topic directly related to caregiving and burnout. We will share suggestions on how caregivers can increase their advocacy skills and how to manage family dynamics. And finally, we'll review and share resources for caregivers. For our purposes today, when we talk about a caregiver, we are specifically talking about family members and relatives like parents, siblings, grandparents, aunts, uncles, cousins, nieces, nephews, grandsons, and granddaughters. We aren't only talking about biological or blood relationships. We are also talking about adoptive relationships, friendships, and neighbors. We are talking about relationships formed by marriage, like step-parents as well. Family caregiving, broadly defined, refers to any relative, partner, friend, or neighbor who has a significant personal relationship with and who provides a broad range of assistance for an older person or an adult with a chronic, disabling, or serious health condition. And that is from the AARP's Valuing the Invaluable report from 2015. So as you can see, there are many different kinds of people who could be caregiving for a person with a disability. And in these roles, there are common challenges and joys these caregivers face. There are also distinct challenges for specific caregivers, like adult siblings, that may be unique. So how is caregiving defined? It means to provide a wide array of help to an older person or other adult with a chronic, disabling, or serious health condition. Such assistance can include help with personal care and daily activities like bathing, dressing, paying bills, handling insurance claims, preparing meals, or providing transportation, carrying out medical or nursing tasks like complex medication management, tube feedings, or wound care, locating, arranging, and coordinating services and supports, hiring and supervising direct care workers, serving as advocate for the care recipient during medical appointments or hospitalizations, and communicating with health and social service providers and implementing those care plans. Caregiving is such a critical role, and in many cases, a caregiver is a person with a disability's lifeline to the outside world. Caregivers know what their loved one likes, what works and what doesn't, what makes a good day for the person, and hopefully what their family members' dreams are for the future. Caregivers are often looked to as an expert on their loved one. Caregivers consult with others and typically play a direct role in decision-making for the person. They're often asked to speak on behalf of the person with the disability. For all of these reasons and more, it is vital that caregivers not only focus on providing assistance with daily activities, but also on the feelings, hopes, wishes, and desires of the person that they're caring for. Kathy Snow, an author, public speaker, trainer, and consultant, who's also the parent of a son with cerebral palsy, writes that real caring grows from our understanding of the inside of a person. She shares a quote from Milton Mayoroff to further illustrate her point. To care for another person, I must be able to understand him and his world as if I were inside it, to see, as it were, with his eyes, what his world is like to him and how he sees himself. Instead of merely looking at him in a detached way from outside as if he were a specimen, I must be able to sense from inside what life is like for him, what he is striving to be, and what he requires to grow. If caregivers continually practice being person-centered, honor and advocate for what their loved one wants for their life, this will directly impact the quality of life for the person with the disability. We all don't just want a good life. We want a fantastic, meaningful, exciting, and happy life. Caregivers can help create that and push others in the person's life to do the same. There are also professional caregivers who provide care and support to individuals with disabilities. You'll see some examples listed here. Personal care attendants, home health nurses, and other direct support staff, like staff who work at a group home or in a facility. Even though we are not going to specifically talk about this group of caregivers, I wanted to mention them because they play important roles in supporting people with disabilities as well. Family members can also be paid caregivers if their relative with a disability has medical assistance and is using a program like the Consumer Support Grant or a waiver. The ARC is a great resource for families who would like to explore their options for being paid. Our advocates can provide information about medical assistance and other disability services, programs, and supports through your county's Developmental Disabilities Department. In order to better understand what caregiving looks like in the United States, we need to take a look at data. Fortunately, there are multiple studies available by institutions like the University of Minnesota and nonprofits like AARP, the American Association of Retired People, that give us a place to start. The Institute on Community Integration at the University of Minnesota, also called the ICI, has a research and training center on community living. In 2010, the Research and Training Center released a report about a nationwide survey called FINDS, or Family and Individual Needs for Disability Support, that was conducted by the ARC-US in 2010. The ARC-US contracted with the U of M to analyze the findings and write a technical report. 7 years later, the Research and Training Center has released an updated fines survey report that again was done in collaboration with the ARC. Almost 6,000 people across the United States responded, and the usable data sample size was almost 4,000 responses. AARP's Public Policy Institute and the National Alliance for Caregiving conducted a nationwide survey for caregivers in 2014 and released their report, Caregiving in the U.S. in 2015. The 2015 report builds on data from 1997, 2004, and 2009, but was the first to use an online interview as a way to collect responses. They received 1,248 responses from caregivers age 18 and up. In the next slides, we'll highlight the overall findings and key themes from each of these important projects. First, we'll look at the Fines 2017 report from the ARC and the ICI's Research and Training Center on Community Living at the U of M. The focus in Fines is caregivers of people with intellectual and developmental disabilities and their unique experiences, roles, and needs. This research matters because there are an estimated 4.7 million people who have an intellectual or developmental disability in the United States today. And according to Fines, of the roughly 1.5 million Americans who are known to their state disability agency, 56% of them live at home with their family and receive at least one long-term care support. Let's take a look at who responded to the Fines survey. You'll see a slide here from a presentation that Amy Hewitt from the Research and Training Center at the ICI gave at the ARC's National Conference in November. And as you'll see here, overwhelmingly, females responded to the Fines survey. 72% of respondents were married. 39% had some college education, and you'll see here 39% were postgraduate. The median income, about $70,000. And if you notice here, 79% of people responded to the survey said that their family member that they're providing care for lives at home with them. And here's a look at the details about the respondent's family member who has a disability. Big topic areas that the Fines survey covers include the kind, amount, and frequency of supports provided by a caregiver, employment for the caregiver and how it impacts their ability to work, caregivers' roles as advocates for their loved one, their worries and concerns about the future for their family member with a disability, caregivers' dreams for the ideal living situation and housing for their loved one, legal and financial planning, and roles that include guardianship and alternative decision-making considerations like setting up a power of attorney. Fines also ask caregivers to share about their family members' day-to-day life, including education and employment for people with disabilities, access to disability services, difficulties finding services to meet the individual's needs and the larger family's needs. Here I've highlighted some of the major findings from the survey. Caregivers said they provide over 80 hours of support to their family member. For the majority, this is unpaid. Caregivers are employees. 60% reported that they work, and 55% work 40 hours a week. This is in addition to the hours provided caring for their loved ones. It can impact work negatively in a variety of ways. Interestingly, the Fines survey noted that caregivers for people with IDD reported higher rates of coming into work late and leaving early, reduced hours, having to take a leave of absence, turning down a promotion, getting written up or a warning at work, quitting, and losing job benefits. They report their family member waiting for 3 years or more for services. This directly impacts the caregiver's ability to take a break, get financial assistance, and access professional services and supports that can benefit the entire family. Only 44% of caregivers said they have a plan in place for the future. If something happened, like their death or an injury or accident that would prevent them from providing care, these 44% have some type of a plan in place. This leaves many families vulnerable, however, to a crisis situation and underlines the need for future legal and financial planning supports for caregivers. The future is something caregivers report having many concerns about. I included the top two tied for first place at 92%. One is the worry that there will be no one else to provide the supports their loved one needs. And the second is that the quality of life and support that their loved one will receive will decrease, which directly, again, impacts the person's quality of life. Other concerns for the future included that their loved one would be vulnerable to abuse or neglect and financial exploitation, move to a facility or institution, and not having people to support their loved one in making their own choices and decisions. And here are the highlights from Fines 2017 for people with IDD. People with IDD are partially included overall in general education classrooms with their typical peers. However, what kind of disability diagnosis a student has does impact the amount of the school day they spend in a separate special education classroom. Graduating from high school at the same rate as what Fines 2010 found, 37%, but are attending college at higher rates, with 17% reporting at least some level of college education. That's up from 9% in 2010. People with IDD are, for the most part, not working, which was 75%, especially people with an autism spectrum disorder and a co-occurring intellectual disability. However, there was an increase in the number of people with disabilities who reported working a regular job in the community from 8% in 2010 to 15% in 2017. People with IDD spend the day at home, 27%, or at an unpaid facility-based activity like a day program if they are not working. And finally, people with IDD report increased difficulties in finding services and supports that meet their needs at a whopping 92% response rate. Now we'll shift from fines to caregiving in the U.S., the 2015 report from the AARP and the National Alliance for Caregiving. This research, while helpful in setting the larger context for caregiving in the U.S., does not focus specifically on people with intellectual and developmental disabilities. The report says that an estimated 43.5 million Americans have provided unpaid care to a child or adult in the past 12 months. 60% of respondents identify as female, 40% as male. 82% said they are the primary caregiver for one person. The average caregiver was 49 years old. 85% of caregivers said they were caring for a relative, and they've typically been in the caregiver role for 4 years. And caregivers who provide 20 hours or more of care a week typically have been in that role for 10 years and up. Caregiving in the U.S. also focuses on the specific needs and challenges of older caregivers who are typically caring for a spouse, providing over 20 hours of unpaid care a week, and managing medical and financial decisions for their loved one and him or herself. Beyond providing assistance with activities of daily living like mobility, which is getting in and out of bed or up and down the stairs and using the bathroom, these caregivers are advocating for their loved one's desires with medical professionals and monitoring their loved one's condition and constantly making adjustments. 40% of respondents interviewed said that they experience a high burden of care, which can lead to high amounts of stress, depression, and burnout. Although there are many commonalities with what the FIND survey found, there are areas that caregiving in the US covers that are distinct, and you'll see them listed here. The report highlights the ever-evolving roles caregivers are taking on, like providing medical or nursing-type care for their family member. 57% of caregivers say they're performing complex, skilled medical tasks like injections, tube feedings, and catheter care. However, 42% said they're doing so without any preparation or training. 22% of caregivers said they felt their health had gotten worse as a result of caregiving. Those caregiving for someone living with a mental illness, living with the person they're providing care for, doing medical nursing tasks, and who are the primary caregiver are more at risk for negative health impacts. When we talk about health, we're not only talking about weight and nutrition, we're talking about mental health and emotional health. Not surprisingly, caregiving can have negative impacts in these areas. The report highlights that people who feel like they had no choice in taking on a caregiver role have higher levels of emotional stress, 53%, and depression. The report identifies a need gap between caregivers who have had conversations with medical professionals about self-care and those who said they would find that helpful. 84% of caregivers said they are looking for more information on caregiving topics like keeping their loved one at home and managing their own stress. They report difficulties in finding affordable services and supports, which directly links to their ability to get a break and have time to do self-care. While understanding the challenges and negative impacts of caregiving is important, I want to make sure we take time to talk about the joys, benefits, and positives when it comes to caregiving. The Boston University Center for Aging and Disability Education and Research surveyed caregivers in 2015 and asked them to share the benefits and joys they experience being in a caregiver role. Those who responded shared that they like having control over the kind and quality of care their family member receives. They feel that there's an improved quality of life for the person receiving care. They feel love, have compassion for, and companionship with the care receiver. There's a benefit to the caregiver staying at home in a familiar and comfortable setting. They often have an improved relationship with the receiver. They feel an increased sense of self-worth and personal satisfaction. They feel useful and needed, and providing care at home costs less. Caregivers I spoke to directly had many positives to share. One said she loved seeing her family member grow into their full potential and was proud to know that she had something to do with it. Another said they felt like she learned what her own strengths and weaknesses are through caregiving and was surprised at how strong she learned she really is. Another sibling caregiver said his interactions and time with his sister are more meaningful as they choose to volunteer and do things to give back to the community where they live. Finally, another said she knows that what she's doing matters and is important, and nothing feels better than that. Now we'll shift to the ever important topic of self-care. I think the watering can here with the tree is a perfect visual. If we're not tending to and caring for ourselves first, we won't have the strength to grow and be there for those who need us. We won't be as empathetic, compassionate, patient, and loving. We might burn out and feel isolated, depressed, helpless, or hopeless. Have you ever noticed when flight attendants are reviewing safety procedures and protocols on an airplane that they tell you to put on your own air mask first before helping children and others around you? It's the same idea with self-care. If you don't take care of yourself first, you won't be able to help others. Self-care isn't only about being physically fit or healthy. It involves a balance of physical, mental, and emotional health. Each area impacts the other and is as equally important. Although it's easy for me to go on and on about the benefits of self-care, I fully realize how difficult it is and might feel to make it happen. It can feel selfish, it can feel overwhelming to plan, and it might feel like a burden to ask someone else to take over so you can have a break. Or you may just be too tired to do it. It can also be hard to ask for help when you're the one used to helping everyone else. The good news is that every day is a new opportunity to keep working on self-care. Self-care does not have to be grand or extravagant. It doesn't have to cost anything. And the best part, you have the power to take charge of your own well-being and make it a priority. You can be intentional and create time to focus on you. I came across the Caregiver's Bill of Rights by Joe Horn. The first right listed says, I have the right to take care of myself. This is not an act of selfishness. It will give me the capability of taking care of my loved one. We can probably all agree that this is one of the most critical rights, but is often the one most easily forgotten. Self-care is not selfish. It is also not a reward. It is a part of daily life, not something you earn. It is something you actively do and work at. You can do self-care anywhere at any time. Even the most simple things like breathing, taking in a beautiful sunset, enjoying the smell of flowers, drinking a hot cup of coffee, strolling around the block, stepping outside for a moment, or calling someone to tell them you love them. Because our thoughts are powerful and shape our attitudes and beliefs and the way we see the world, having a mantra or an affirmation you repeat, either out loud or inside your head, can be an easy place to start that can help reduce anxiety. One of my personal favorites is, I'm doing the best I can. Another could be, I matter, or I am strong. Another, how about I choose positivity and happiness? Focus on positive self-talk and thoughts. Your mind tends to believe what you tell it. Don't underestimate the power of your thinking. As I previously mentioned, physical health is one important component of self-care. Physical health can mean the strength of our muscles, how much exercise we get, eating healthy, and having healthy levels of blood pressure and cholesterol. One concept that I've learned in my person-centered planning work that resonates with me in this area is called important to and important for. Things that are important to someone are generally the things that truly matter to them and are motivating to them. On the flip side, the important for typically relates to someone's safety, health, and overall well-being. There tends to be a lot of focus on the important tos in the life of someone with a disability, but it's all about finding a balance between the two that creates a good life. If you spend time defining what important to means in your life and work on balancing it with the important for, which in this context is exercising, eating well, cutting out sweets from your diet, etc., you may be more successful in doing self-care in this area. For me, I'm a social person and I love spending time with others. If I can mix that motivating factor with exercise, like a designated workout buddy or a group class where I can meet new people, it feels less painful and maybe a little more enjoyable. If you love shopping but hate exercise, could you go walk around the Mall of America and window shop? Does a solo dance party in your pajamas on a Friday night sound like fun? Looking to connect with other caregivers while doing an activity? Check out your local community education classes. Be creative. The possibilities are endless. Involving other people and asking them to hold you accountable is another key factor to self-care for your physical health. Stating your intentions out loud and sharing them with friends or family makes them real. What are you willing to commit to? When you think about your physical health in the future, what is your vision? Investing now will definitely pay off later. Do the best you can. Another critical piece of self-care is your mental health. As we've covered in this presentation, many caregivers are at elevated risk for depression, anxiety, and other mental health conditions. While this may not be an easy area to talk about, it is incredibly important and needs to be acknowledged. One thing that I've learned during my time with the ARC is the power in sharing stories. Stories help change attitudes, can influence policies, and offer depth and meaning to topics that may otherwise seem impersonal. For some caregivers, sharing their story can be therapeutic. The actual process of documenting, editing, and then sharing their story may have a healing effect, not only for the storyteller, but those who hear it. As a caregiver, you are the expert on your experience. You know what you need, you know what isn't working, and you know the daily impact caregiving has on your life. You're living it. You could share your story with a locally elected official, you could blog about it online, or you could write it down and send it in a letter to someone you trust. It's all up to you and what kind of impact you want your story to have. Finding someone you trust to talk to is another important piece of mental health. Do you feel comfortable confiding in a best friend, spouse, sibling, coworker, or would you prefer to speak to someone unbiased, like your doctor or a mental health professional? It's a sign of personal strength to reach out and ask for help. It takes courage and bravery to admit when you're feeling depressed, isolated, sad, and hopeless. Mental exhaustion can also have damaging impacts on mental health. Caregivers are constantly planning ahead, coordinating, managing, and worrying about every little detail. It's a 24/7 nonstop loop. How can you do self-care in this area? One piece of advice caregivers shared with me is saying yes to help and having specific examples of ways that others can support you. People want to help. They care about you and they want to feel useful. Let them help. Take the time to jot down specific tasks or activities you can ask them to take on and keep that list handy on your phone or in a notebook you carry with you. Consider the specific skills and interests of the people in your support network. You may not want to ask someone who hates driving to take your family member to doctor appointments around the cities. Instead, maybe ask that person who you know loves to cook to prepare some dinners for you and your family a few times a month. It can be hard to let someone else take over, or you might think they won't do it the way I do, or if I just do it, it's quicker. These misconceptions are roadblocks to self-care. How can you push yourself to cope with the discomfort of these thoughts and feelings? If you're willing to try it, you will most likely be pleasantly surprised by the benefits. Even though we live in a society that promotes and values independence, the reality is that we're all connected and are interdependent. Just like it's okay to say yes to help, it's also okay to say no. Do you find yourself saying yes to everything right away and then later regretting it? It takes practice to stop, to ask yourself, can I do this? And then respond instead of reacting right away. Saying no and being honest and direct about it is giving yourself the same respect as you'd give anyone else. This is also a healthy way to set limits on others' demands of you, which is an important part of self-care. Cultivating your ability to say no takes work, but with practice, you will get more comfortable doing it. Emotional health has everything to do with feelings, how we experience them, how we process them, and what we choose to do with them. Regardless of how you may have ended up in your caregiving role, there are emotions that will surface as a result, some right away, and others after you've been caregiving for some time. Please know that you and your feelings matter. They are not only allowed, but they are valid, and they are a part of what you are experiencing. It is also okay to have negative thoughts and feelings about your situation. It's when they are ignored or repressed that they become like a ticking time bomb. Emotionally healthy people are aware of their feelings, and it does not mean that they are happy all the time. They have ways to cope with negative feelings and have the strength and awareness to reach out for help when they know they need it. We've covered a variety of suggestions for ways to cope with stress during this presentation, and a key way to do self-care in this area is stress management. One example and possible coping mechanism to manage and hopefully reduce stress is called do it, dump it, defer it, and delegate it. It's pretty straightforward. Write down a list of tasks that need to happen. Take the list and start identifying the priorities, the things that must get done first. Go through the list and start deciding what things you can do, which is the do it, what things can wait, which is defer it, what things can go, which is dump it, and what things you can ask others to do or take on, which is delegate it. Another productive way to channel your emotions while reducing stress and doing self-care is being creative. Painting, dancing, making music, doing a craft project, knitting, sewing, sculpting, drawing, writing, and journaling are some ideas to get you started. These activities offer an outlet for self-expression and to process what you're feeling while giving your brain something to focus on. For most caregivers, an almost inevitable part of their role in the life of the person they're caring for is being an advocate. The term advocate and the idea of advocacy may mean very different things depending on who you ask. Words used to describe an advocate include promoter, supporter, defender, champion, speaker, and upholder. Advocacy is defined within a systems context, meaning we think about legal advocacy, like a lawyer defending someone in a courtroom. We might think of a hospital setting where a social worker is helping a patient speak up about their desires when it comes to medical care. Advocacy is this, and it is so much more. It doesn't always have to be formal. It could be sharing your experiences with neighbors over coffee, or writing a letter to the editor on a caregiving related topic that impacts you or your family member directly. It can be calling your legislator's office to share the importance of your family member's health care and services that allow him or her to live at home and in your community. Advocacy can be for others, and it can also be for yourself. And as the research has shown, as a caregiver, it's increasingly important that you are advocating not only for the person you're taking care of, but also for yourself. Caregivers who share their insights on advocacy frequently mention their role in supporting their family member within the medical or healthcare system. Depending on the diagnosis or medical conditions their loved one has, caregivers share that they often lack the information and training needed to provide care and to know what questions to ask or what medical treatments and options to ask for. Many said they feel like navigating insurance coverage, like renewal forms, explanations of benefits, referrals for out-of-network specialists, medical bills, is an overwhelming full-time job. Fortunately, there are many national and state organizations out there to help caregivers learn how the medical and healthcare systems work, what kinds of questions to be asking, and how to build their advocacy skills with medical professionals. These will be highlighted in the resources section at the end of the presentation. Another interesting suggestion that came up from many of the caregivers I talked to that directly relates to advocacy is organization. As you've probably already experienced, managing the paperwork for your family member can feel like an unwinnable feat. Caregivers said that getting a filing system set up right away was one of the best things they did. Part of advocacy is documentation, knowing where it is, reviewing it, and understanding what's in it. Caregivers suggested embracing technology in this area and using scanner apps for smartphones to electronically store paperwork. They also said that using accordion folders with labeled tabs for different doctors and specialists and keeping the most recent documentation at the top made life so much easier. You can grab the folder and have the peace of mind that everything you'll need is in one place. Looking at caregiving within the context of a family is critically important because caregiving radically alters relationships within one. Families are dynamic, unique, and very different. How one family views caregiving may greatly differ from another. There are different styles of caregiving that families may fall into, like solitary caregiving, which is where one person provides, observed caregiving, which is one person provides and the rest chime in, the tag team approach, which is sharing responsibilities one at a time, or an uneasy caregiving alliance, which is no conversation about long-term goals and everyone is on a different path. The ideal style of caregiving is collaborative, where all family members provide care based on the unique strengths and skills they bring to the table. So how do you get there? There are many variables that families must navigate, and for many caregivers, this unfortunately can be a source of stress, worry, and frustration. Challenges may arise when family members have different definitions of caring and what the limits of caring should be. Different attitudes towards the person needing care also cause challenges within a family. If one member doubts or is in denial about the seriousness of the illness, disease, or disability, it can cause conflict. Does the primary caregiver feel appreciated and thanked by other members? Does one family member have more time, resources, or skills to provide care than another? All of these things are challenges that families are facing on a daily basis. Different or unspoken expectations about family members' roles as caregivers and providing care can also create difficult family dynamics. A sibling may feel an unspoken obligation to take on a caregiving role, for example, as their parents age and can't care for the member with a disability in the same way they have in the past. It may be assumed that a sibling who lives out of state won't be contributing as a caregiver because of the geographical distance, but maybe in reality that sibling really does want to be involved. A first step that you, the caregiver, can take to truly look at your current situation and evaluate what support family is providing and what is missing is to take a caregiver assessment. There are a variety of organizations like Family Means, Wilder Foundation, DARTS, and Volunteers of America that offer these tools. What you learn through the assessment can be used to guide a discussion with family members about your role, what support you need, when you should bring in outside support or professionals, and how others can step up and take on parts of caregiving that align with their strengths. Another wonderful resource is our planning services at the ARC Greater Twin Cities. All of our programs use person-centered planning tools that help families look at who's involved in their family member's life, what's working and not working, and what's important to and for the person receiving care. Our planning specialists help families break down caregiving into pieces and create a team-like approach so it's not just one person doing everything. We can guide discussions to answer the question, what will happen to my loved one when I'm gone? Not only do we help with the information and referrals to legal and financial planners and supports, but we also help capture the details about what makes a good life for the person with a disability. It's documented in one place, so if something happens to the primary caregiver, there's a plan in place that will help avoid a total crisis situation. If you'd like more information about our planning services, visit our website or give us a call. Finally, a few caregivers I spoke with suggested mediation as a helpful resource when a family is entrenched in their position or can't move discussions forward for whatever reason. It can be helpful to have an unbiased outsider to facilitate a discussion, to ask questions you aren't even thinking about, and to push members to look at the situation differently. Now we'll review resources for caregivers. Before I start, I wanted to mention that I will be emailing out a list with links to the individuals who registered for this webinar. There is also a copy of the list in the handouts drop-down section on the taskbar. You can download and save the document on your computer and use it for future reference. If you are listening to a recording of this webinar and would like a copy of the resource list, please email us at info@arcgreatertwincities.org and we'll make sure it is sent to you. On this slide, you'll see resources I've listed around research and policy. I have included links to the ARC, our national chapter based in Washington, D.C., where you can find a copy of the presentation slides from the FINES 2017 survey that was presented at the ARC's National Convention in November. I've also included links to caregiving in the U.S., Valuing the Invaluable, which are both reports about caregiving in the United States from AARP. I've also included links to the Research and Training Center for Community Living at the U of M. And then the two caregiver identity theory and the 9 concepts in family systems theory is some further reading and resources if you're interested in understanding those theories and how those impact family dynamics when someone is caregiving. Resources on this slide are for information, assistance, and advocacy. You'll see the ARC Greater Twin Cities listed first. I've included PACER, which is a statewide nonprofit that provides advocacy support, information, and resources for families. It does include children and adults that have intellectual and developmental disabilities, but also PACER does serve a wider array of disabilities than we do at the ARC. The Metropolitan Area Agency on Aging is a great resource. Disability Hub Minnesota, the Minnesota Department of Human Services, Disability Benefits 101, which is a fantastic online resource that has information geared towards transition age students, which is typically age 14 to about 22 years old, that have disabilities, and it basically gives information about healthcare, Social Security benefits, how work impacts those programs and benefits. And there is also a live chat feature on the website that is confidential that I have used many times myself. I've included minnesotahealth.info, Senior Linkage Line, and your county human services and financial assistance departments. And again, as I mentioned earlier in the presentation, those are services and supports that we at the ARC can also provide more information and assistance around. Here are general resources around caregiving. Many of these organizations are national organizations. So you'll see the National Alliance for Caregiving, the Rosalind Carter Institute on Caregiving, the Family Caregiver Alliance, the Caregiver Action Network. The U of M Savvy Caregiver Manual is a link to a PDF version of the manual that walks through caregiving. There is more of a focus on caregiving for someone with dementia or Alzheimer's, but however, there are some really good topics and suggestions and resources in the manual that I would recommend you take a look at. I've included links to Kathy Snow's website where you can read more about kind of her perspectives and on being a parent and an advocate and a caregiver. And then I also have included the title of the book on Caring by Milton Mayeroff. I shared a quote from that book early in the presentation. When I talked about caregiver assessments and consultation, these were the 4 agencies that I had mentioned: Family Means, Wilder Foundation, the Volunteers of America, and DARTS, which is actually located in Dakota County. On this slide, you'll see resources around adoption and medical or kind of healthcare systems type of resources. If you happen to be a caregiver who has a child or family member that has joined your family through adoption, these are 3 wonderful resources that I would highly recommend you look into. The North American Council on Adoptable Children, or NACAC as the acronym is called. They are located in St. Paul and do provide quite a bit of support to adoptive families around navigating kind of legal processes, how the adoption system works, financial supports, and they have a very robust online caregiver and kind of parent Facebook group that has been a great resource, at least what I've heard from families who have joined that. MinAdopt is also in St. Paul, and they can provide information and assistance to adoptive families that might have questions about resources. And then finally, if you are someone who has a child, maybe you've adopted a child who has a fetal alcohol syndrome disorder, you can contact MOFAS is the acronym, and they provide a lot of information and support and advocacy to families and individuals in that area. The medical resources, Family Voices of Minnesota, another wonderful nonprofit that really does focus on serving children and families who, children that have high kind of complex medical needs and need a lot of medical care. They're a wonderful resource and provide a lot of family-to-family support and mentoring. Got Transition is a great resource for young adults with disabilities who are transitioning out of the pediatric kind of younger child healthcare system into the adult healthcare world. There's great ideas and suggestions and tips on how caregivers can help really support and teach their young adults how to take more ownership and be more involved in their health care. That's everything from calling to make a doctor's appointment, carrying a healthcare card, knowing what prescriptions that they might be on and how to talk about those, everything you can think of. So it's a great resource. It's online. And then finally, there's a great webinar that was just actually presented last week by the ARC US. It's under their archived webinars on their website, and the link will take you straight there. But it was a great webinar called Aging and Intellectual and Developmental Disabilities, Planning for Growing Older. I would highly recommend that you check that out. I thought that was a very helpful and really thorough webinar. And siblings. So here you'll see there are a variety of resources for siblings who might be in that caregiver role. So Sibling Tree is a fantastic resource. Actually, the presentation that I've listed on the slide called Siblings, the Past, Present, and Future, the link to that presentation was actually a sibling, adult sibling, who is the CEO of the Sibling Tree organization. And so check them out. There's the Sibling Leadership Network, SibNet, which is an online forum for siblings to connect, and I believe they also have a Facebook group. And then Don Meyer is a sibling himself, and he has written a number of books and has done Sib Shop training across the country, which is a program specifically for siblings of children with intellectual and developmental disabilities. So the link here is a profile of him, and it does have more information about the titles of the books that Don has wrote and how you can learn more and take a look at some of the work that he's done. And finally, that last webinar, Strategies for Professionals to Work with Siblings of Individuals with IDD, was another webinar put on by the ARC US. And again, this is found on their archived webinar page of their website. So at this time, it doesn't look like there are any comments or questions, but I will give a couple more minutes just to see if anyone has any questions or if there are any comments on this webinar tonight. Please feel free to type those in. You can use the text box in the question drop-down section of the taskbar. Otherwise, if there aren't any questions, I'll give a few minutes. If there aren't any questions, we will be ending a little bit early. But on this slide here, you will see that our contact information is here. My name is Jen Johnson. Again, I am a senior advocate here at the ARC. You'll see our website listed here. Our phone number, 952-920-0855. And info@thearcgreatertwincities.org is our email address. And again, if you have any questions, comments, any ideas on future webinars that you would like to see the ARC present, you can please pass those along to us either by emailing us or calling us or sending those thoughts to us through our website. So I'll wait just a few more minutes to see if there are any questions. And then if not, we will end a little bit early. Wonderful. Well, it doesn't look like we have any questions, so we will wrap up the presentation this evening. But again, I want to thank you for joining me tonight. And again, if there are any other comments or questions that you have or things you think of as the holidays approach, I know there can be a lot on everyone's minds getting ready for the holidays with family. But please feel free to follow up with us. And again, thank you for joining us and have a wonderful evening. Thank you.